Tina's husband had chronic illness and he passed away. She was sad, lost sleep, had difficulty in remembering things, always tired. Tina was referred to a mental health professional and was diagnosed with depressive disorder. Guilt was a driving factor of her depressive symptoms, which lasted 6 months after his death. Everyone goes through periods of deep sadness and grief. These feelings usually fade away with a few days or weeks, depending on the circumstances. However, intense sadness that lasts more than 2 weeks and affects your ability to function may be a sign of depression. Let's get into the details. Types. Major depressive disorder. When people use the term clinical depression, they are generally referring to major depressive disorder. Persistent depressive disorder, PDD. While the symptoms are not as severe as major depressive disorder, they are pervasive and long-lasting. Bipolar disorder. The vast majority of those with bipolar disorder also have episodes of major depression. The risk of suicide in bipolar illness is about 15 times greater than in the general population. Psychosis, including hallucination and delusions, can also occur in more extreme cases. Postpartum depression. Pregnancy can bring significant hormonal shifts that can often affect a woman's moods. Depression can have its own onset during pregnancy or following the birth of a child. Premenstrual dysphoric disorder. Among the most common symptoms of premenstrual syndrome are irritability, fatigue, anxiety, moodiness, bloating, increased appetite, food cravings, aches, and breast tenderness. Seasonal affective disorder. If somebody experiences depression, sleepiness, and weight gain during the winter season but feel perfectly fine in other season, then they may have a condition known as seasonal affective disorder. It is more common in far northern and far southern regions of the planet and can often be treated with light therapy. Atypical depression. A type of depression that doesn't follow what was thought to be the typical presentation of the disorder. Symptoms. There are several different types of depression and the symptoms vary among individuals. While anyone can experience some of these symptoms from time to time, a doctor will only diagnose depression when a certain cluster of symptoms appear and they persist for 2 weeks or longer. Feeling sad or empty, that is, unable to feel joy or happiness. Some people may describe this sadness as despair. Feeling hopeless or helpless. They may say or think that no one can help them get better and that they will always feel depressed. Feeling worthless. They may believe that they are a burden to others or that the world or their family is better off without them. Feeling excessively guilty. Ongoing feelings of guilt that are inappropriate or disproportionate to their situation. No interest or pleasure in activities. They may turn down offers or opportunities to do activities or be with others. Anger and irritability. Men are more likely than women to experience irritability and anger as symptoms of depression. Feeling tired and loss of energy. Feel too fatigued to do everyday tasks, such as going to work or cooking meals. They may spend a lot of time at home resting or sleeping. Insomnia or lack of sleep. Have trouble either falling or staying asleep. They may stay up very late at night or wake up very early in the morning. Difficulty concentrating, remembering, and making decisions. Depression can interfere with a person's cognitive abilities. Lack of appetite can cause weight loss. They may have little interest in eating and go for long periods without food. Overeating and weight gain. For some people, food can become a comfort mechanism for negative feelings or a way to deal with boredom or being alone. Such kind of people eat more and they gain weight. Aches, pains, and physical symptoms. Persistent physical symptoms that do not respond to treatment. These include headaches, digestive disorders, unexplained aches and pains. Thoughts of death or suicide. Depression is a common but serious condition that can be life-threatening. Not every person who thinks about suicide will attempt it. However, if someone mentions suicide, either contact a doctor or help them seek urgent medical care. Causes. Biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, and from thyroid problems, menopause, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. Childhood trauma. It can cause an individual to be depressed for a prolonged period of time. Examples of such traumas are severe illness, isolation, physical, sexual, or mental abuse, witnessing a traumatic event and neglect. Regardless of the trauma, childhood experiences are one of the most common causes of major depression. Major life events. It can cause severe depression. Losing a loved one, taking a high-stress job, and facing tough financial situations are all known as causes of depression. Medical conditions. Depression may occur along with chronic or serious medical conditions like cancer, heart disease, diabetes, and Parkinson's disease. Diagnosis. Physical exam. Doctor may do a physical exam and ask questions about health. In some cases, depression may be linked to an underlying physical health problem. Lab test. For example, doctor may do a blood test or test the thyroid to make sure it is functioning properly. Psychiatric evaluation. Mental health professional asks about symptoms, thoughts, feelings, and behavior patterns. They may ask to fill out a questionnaire to help answer certain questions. According to DSM-5, the symptoms must cause the individual clinically significant distress or impairment in social, occupational, or other important areas of functioning. and the symptoms must not be a result of substance abuse or another medical condition. Then it is diagnosed as a depressive disorder. Management. A person needs timely and accurate diagnosis, support, and access resource and treatment to manage depression effectively. Medications and psychotherapy are effective for most people with depression. Primary care doctor or psychiatrist can prescribe medications to relieve symptoms. Medication. Antidepressant medication may be used as initial treatment for patients with mild, moderate, or severe depressive episode. Psychotherapy. Clinical features that may suggest the use of specific psychotherapy include the presence of significant psychosocial stresses, intrapsychic conflict, and interpersonal difficulties. Cognitive behavioral therapy and interpersonal therapy are the psychotherapeutic approaches that are proved for management of depression. When appropriate, psychoeducation can also be provided to involved family members. ECT or electroconvulsive therapy. It may be considered in virtually all cases of moderate or severe major depression who do not respond to pharmacological intervention. Approximately 50% of medication-resistant patients exhibit a satisfactory response to ECT. Lifestyle and home remedies. Learn about depression. Educate yourself and encourage your family to learn about depression to help them understand and support you. Avoid alcohol and recreational drugs. In the long run, they generally worsen the symptoms and make depression harder to treat. Take care of yourself. Eat healthy, be physically active, and get plenty of sleep. Consider walking, jogging, swimming, gardening, or another activity that you enjoy. Stick to your treatment plan. Don't skip psychotherapy sessions or appointments. Even if you are feeling well, don't skip your medications. Yoga and meditation. Studies show that yoga therapy can help with stress, anxiety, and depression. The body releases feel-good hormones called endorphins, which can help to relieve anxiety and boost mood in people with mild to moderate depression. Techniques like breathing and meditation, the two practices used in yoga, it can help to ease symptoms of depression. Hope you like this video. For more videos on related topics, please subscribe to this channel. Thank you. Keep smiling.